everybody, good evening, good afternoon, good morning from wherever you're watching from. My name is Tanisha and welcome back to another House of Medic stream. Very happy over there, Jane? Lovely, so let's get straight into it. I'm going to allow you guys to just introduce yourselves. I know you guys know what today is about. It's about nurses and midwives, so let's get straight into it. So I'm going to start from my far left. If you want to tell me your name and what you do.
Okay, hey guys, so my name is Marie Catherine. I'm a third year student nurse. I study adult nursing and I also have a nurse page called Nurse Diaries UK as well.
Hi guys, my name is Anita. I'm a senior staff nurse, currently working in London, and pretty much what I do. Yeah.
Hi everybody, my name is Kemi. I'm a midwife. I'm also a health visitor, specialist in public health. I'm also CEO of Professional Auntie, and I'm mother of one.
Thank you.
Hi everyone, my name is Jadesola and Kemi. I am a diabetes specialist midwife. And I'm also an antenatal class teacher. And I'm currently doing my master's in advanced clinical practice.
Sure enough now. Lovely. So you both are midwives, and you both are nurses. So as we done one of our previous streams, we're basically going to have like a battle of the midwife and nurses. So I'm going to go ahead and say what I think a midwife and a nurse is, or what their job role is. So like I said before, I think midwives only. You guys are midwives, right?
Yeah.
Midwives only deliver children.
Yeah.
I haven't heard of anything else. I'm not sure what else you guys would do. If anyone's heard of anything else that midwives do, please let us know, because I've never heard.
I'm sure, Jade, we hear this all the time.
We talk now about it.
Okay, in short, can you tell me the definition of what a midwife is?
Okay, to be a midwife is to be with women from conception, even postnatally, which can be.
So for those of us who don't know what postnatal means.
Okay, so throughout the childbirth continuum, so from the moment you conceive that, okay, you're pregnant, up until you've had your baby, and then weeks after you've had your baby. So that's what we do. So it's not just delivering your baby.
Although we hear that all the time. How many babies have you delivered? There's so many parts of your pregnancy, parts of your labour, parts of your afterbirth that midwives can specialise as you are a specialist. That is not just about delivering a baby.
So it's from the beginning and end of the pregnancy.
Yes. And after.
And also, I think very soon you'll see a lot of midwives do preconception care.
What's preconception?
Before you actually find out you're pregnant, you're trying to conceive.
Oh, so you guys help with people getting...
Some midwives do.
You could specialise in like fertility care, especially because now we're in a generation or a climate where lots of pregnant women are now coming in with complex issues. So I work in maternal medicine. So
What's
I see
maternal medicine?
So maternal meaning mother.
We're coming to you.
Maternal meaning mother, medicine meaning medicine. So ranging from hypertension, diabetes, twin pregnancy, heart conditions, you name it. And a lot of women are coming now with complex issues. And a lot of what we find is before they get pregnant, they're not getting the right care. So
and more of an older generation of mums, and I think we're in a climate where there's a lot of older generation mums, so they can fall into trap of maybe find it a bit more complicated or need that help to actually become pregnant and conceive.
In short, in a couple of sentences, what? I think I said earlier as well. In my head, a nurse is someone who maybe looks after the elderly before they're about to pass.
No.
Still Jade's quote. A nurse is also with you from birth to death. So we, a nurse is also here, like there to look after you the moment you're alive to the moment you pass, and even a bit of afterlife care as well. So when a person passes, we don't just leave them on the bed. There's things that we do afterlife. To care for the person.
You see people from completely different ages. You can see 18-year-olds,
or you can see the elderly. Like, it really does depend.
80-year-olds.
Yeah, so every shift is different, every patient is different as well.
So what's the difference between a doctor and a nurse?
Let me tell you. Sorry about the doctors in the room. The doctors basically come, do this, do that, and we're actually the ones doing a lot of the tasks. So nursing is a very tasking job.
You're not doctor's assistant?
No, we're not. We're nurses, yeah. So a nurse is basically with a patient from the start of the shift at the bedside to the end of the shift. So we're the only profession that spend the most time with the patient. Like I would say, would you not agree?
Yeah, I feel like nurses know more about their patients. You do spend more time with them. You know the small things like what makes the patient happy, or maybe, for example, or if they have like a wish that they want, for example, like calling their family to tell them this information before they go to surgery. Like, we're the ones who do the special things that other people don't know about. And if like something was to happen to them, we would advocate for them. So I don't know, like doctors diagnose and stuff like that, and
we care.
Yeah, we care about them.
We do the actual care in terms of caring. Of course, the doctors do care, but we take care of the patients in physical terms, mental terms, everything terms. Do you know what I mean? So it's not just.
Do you guys care for your patients?
Of course. We have a lot. We're one-to-one with the woman. We're so many times as one part of our midwifery care, like in labour, and all the time we're one-to-one with these women. There's times we can spend a 12.5-hour shift just with the woman and their family and their partners, and giving that support while a woman is in pain, while a woman is in distress, and just such a very emotive time for them. And it's that one-on-one intense care. And I think one of the things, we love our nurses, but autonomy. We don't wait for doctors to tell us anything. We are in charge of our care more than we don't have to wait for the doctor to tell you all the time.
Not necessarily.
To make certain decisions.
Clinical intuition. So there's a lot of things that we do on our own clinical intuition.
There is. I'm not saying there's not.
And I have to say, there's some roles in nursing, like specialist roles, where they do work autonomously. Like they don't have to look for a doctor's advice or a doctor's help. Like district nurses, for example, it's very one-on-one care. So they're in the patient's house, let's say residence, and they have to look after the patients. There's no doctor behind them to tell them what to do. So
I think
that is
the difference with midwifery. You start off being an autonomous practitioner. So as a band 5, being an autonomous, so single practitioner, working on your own. So the good thing about midwives is, from what I find, maybe kind of senior now, but you work alongside.
She has to say.
We work alongside them, so they feed off your knowledge as well. So they can ask you, Jade, what do you think about this case? Whereas before, probably it would be, this is what I think is what we're going to do. And I think when you specialize as well, everything about medicine is about learning. So I'm studying now, so I'm learning. So I probably know a little bit more than maybe someone else would know about a particular topic. So we always feed off each other, and I think that's the good thing about midwifery. You never stop learning, and things are always changing. So if you're able to keep up with those things, you become the best practitioner and the better, better for your patients as well.
Another thing I would say as well is one of the things that may be different is the fact that even just in terms of drugs, prescription medication we give to our women, is the fact that how we have, when we train, there's a list of many medications we can give without any doctor's consent. We can prescribe it ourselves and we can just go along. And that's one thing where I meant, not we love nurses, like I said, but just the things that where we start off very independent because it's such an emotive time. There's and also demand of urgency that can come across during that time of a woman. If she needs pain relief, there's some we can just give straight away because doctors can be very busy and waiting hours and hours, as we all know, for to come from surgery. We can just give a list. There's lots of many ones we can just give without waiting for a doctor.
Are you guys completely autonomous? Like, in case of a
major
emergency, obviously, you do get help.
Of course,
So you get the doctors do come in.
We do. But I mean,
No, but
we do.
With any emergency, you can't single-handedly do it.
We need everybody.
Negligence. To think you can handle,
It's a team.
You need help.
And we need teamwork in any of it, in health professionals.
Have you guys heard of nurse prescribers by the
That's,
way?
so you training to be
okay.
I'm a nurse prescriber.
I can also train to be a nurse prescriber.
Yeah, I'm a nurse prescriber.
Wait, what is a nurse prescriber?
So a nurse prescriber is a nurse that can prescribe medication on their own. So usually with registered nurses, we have to wait for doctors to come and prescribe the medication, and then we can actually administer the medication. But with nurse prescribers, they can do it themselves. So for example, let's say a nurse is working in the community and she wants to prescribe medication to a patient, she can do it herself and tell the patient, you can go to the pharmacy and collect this medication, for example. But that's with like extra training.
Yeah, see, Anita pretended to
I know.
So we're going to have a quick interval. So I just want to say, guys, to everybody, please make sure you're sending your questions for the midwives and the is that right? Yeah, the midwives and the nurses, please. Anything you want to know, today is the day to drop your questions to get a good answer. So please make sure you do that. And shout out to Flaky Bakes, who are one of our sponsors for today as well. Thank you for everything that you do. And make sure you hit the thumbs up button so you like this stream as it's streaming. So, a couple of questions. I just want to go back a little bit. How did you guys get into what you do? So I think I'm going to start with you, Marie, because I feel like everyone's just shouting at you. We're going to start with you. Talk to me how you got into wanting to be a nurse, or you're studying to become a nurse?
So I was my third year, so final year.
It's at university?
Yeah.
So like a normal uni?
Yeah.
No, because,
Girl.
let me explain why, because sometimes on the other streams that I've done, people have gone to say that they went to medical school. Yeah. Isn't it? Yes, I thought it might be a nurse school or something. Okay,
In
cool.
uni,
So
it's called nursing school, like the faculty itself, but
It's actually
it's
the
within the university.
okay, cool. So talk to me about how you even got interested in that.
To be honest, I can't lie, like when I was younger I used to watch like medical stuff and I was like, oh, this is cool. And then like growing up, I didn't really have anyone in my family who's in the medical field or does nursing or anything like that. But one of my teachers was a nurse, and then she was a midwife, and then she was a teacher. And like hearing all of her experiences was really, really interesting. And for me, when she was saying the things that she'd done as a nurse, I found that more interesting than midwifery, no offense. But so that's why I chose nursing, because of the different things that we can do. We can see so many different things, specialize in different fields, and to me it was really interesting.
Okay, cool. Yeah. Thank you. So just want to talk to you about your studies a little bit, because we do have quite a few students that are always watching us as well. Has it been hard? What was the hardest year?
It's still hard.
It's so hard.
It's still hard. I'm still struggling. It's 3 years, so I'm in my final year. So I graduate in the summer, but I'm still like struggling. I think with university and with nursing, and to be honest, with any course, the problem is when it comes to placement and having university at the same time, it can be so draining.
So is that what you do?
Yeah.
Placement, I know this one. Placement is when you go and work in a hospital as a nurse and you're studying at the same time.
Right. You don't get paid.
You don't get paid.
But same hours.
Hi, Tutu.
said my girl Kemi.
So that's what I find really, really challenging. Yeah, 12 hours. So do
12 and a half hour shifts.
12 and a half hour shifts.
So you go to uni to do your stuff?
Okay, so some universities have like placement and university at the same time, which I don't understand. With the university that I go to, I have placement for like, let's say 12 weeks or 6 weeks, 8 weeks, depends. And then when I finish with placement, then I have university. But the thing that I'm complaining about is the fact that you still have assignments on the side. So let's say like you have placement. You still have assignments due. So that's what's really hard, like motivating yourself or giving yourself enough time to actually do what is needed.
But you're in your first year.
Yeah,
You're
somehow,
close.
somehow, like you just have to keep fighting. Thank you.
Okay,
And
Kemi,
Kemi, how did you get into midwifery?
I think for me, I've always thought, in fact, I wanted to be a doctor initially when I was younger. Then I thought 7 years in university, never me. So then my mom, my mom had my youngest brother, and then I kind of followed her through that, and I was like 13 at the time. No, she was pregnant with my youngest brother. So I always went to the appointments with her, scans, and I met her midwife, and I thought, oh, okay. And then I liked that. What were you? Your midwife. And then I went to my sister, she was going to university at the time, and I found out about the course. I was like, this sounds really good. 3 years, you're with a woman, I like babies. That's what you think initially, that's what it is. And yeah, so I joined, I thought this is it. Determined, this 3-year course, I'll be done. And I thought, great, I can do it. My dad is a mental health nurse. So he was like, do nursing first, start there. I was like, no, I think I can't see people pass away or those kind of things. And he was like, do it first. And then I was like, no, but then I just did direct entry to midwifery at the time, which was allowed. And here I am, midwifery. And it was the open doors for me on the way. And I haven't looked back since. And I love it.
So how long have you been, is it a practice in midwife? Is that how you say it?
Yeah, I've been practicing as a midwife, going to be 10 years in December.
Wow.
Sounds crazy to me, actually. Yeah.
Wow.
But then
you obviously love what you do and have like this great passion.
I love midwifery. I've gone on further to do especially public health nursing, which is a health visitor. Yeah, after they've had a baby. So I do love the women and children, clearly. So that part is just a follow-on from after they've had a baby, even longer, up to they're 5. So, but I've always maintained my practice as a midwife. And yeah, I love it. It's just something, they had its up and down days as any job does, but I've never got over the thrill of being through that whole process with a woman, even the thrill I get whenever a baby comes to the world. So, yeah.
Lovely, thank you.
You're welcome.
Jade, I want to come over to you. Sorry, Jade, I want to come over to you.
Hey.
You mentioned something about diabetes. What was that you did within diabetes?
So I specialise in diabetes in pregnancy.
Oh, wow.
As a midwife,
So the baby would have diabetes? Or
No, actually. So you either get patients that come in that are pre-existing diabetics, so either type 1, which you normally would have around a very, very young age. But now we are seeing, I won't go into it too much, but we're seeing a lot of adults having type 1 diabetes.
Can I ask what type 1 diabetes is? Or what is diabetes? Just in case any of our viewers doesn't know.
It's an autoimmune disease where the person isn't producing insulin, so they have to inject insulin
and what does
daily.
Insulin fight off?
So it's basically what we all have in our bodies, with glucose, when we eat, etc. So these people don't actually have it, so they have to
There's no
inject
sugar
it.
in their bodies.
No insulin. The pancreas isn't producing insulin.
It's technical.
And then there are people that have type 2 diabetes, which can sometimes be environmental, from family history. If mum or dad has type 2 diabetes, they could potentially have it as well, diet, etc. And then there's other different types of diabetes. I can't really go into like MODY, etc. And then some women actually develop gestational diabetes. So the term gestational is pregnancy. So you could have gestational hypertension.
So you'd only get that when you're pregnant?
Yeah, so it's to do with the hormones that the placenta produces. And as the pregnancy advances, your body becomes more insulin resistant. Now, there are people that have risk factors for this. So around 28 weeks, they would get tested with what we call a glucose tolerance test. And then from that point on, I then caseload them up until they deliver. And then women that possibly have had it before in their other pregnancies, when they get pregnant again, they do have this test earlier because it could develop earlier. So that's basically what I do. But there's a lot more detail into it because it can involve insulin and
I have a question. You mentioned that you are a senior midwife.
Yes.
How long did it take you to get to that stage?
So I've been a midwife now for 6 years, and I became a band 6 midwife within a year, quite quickly, because I was on labour ward. I finished all my competencies.
Does that mean you were really good at what you did?
I don't want to toot my horn.
This is a platform.
This is it.
Toot the horn.
I'm very hardworking, and I want to make sure that I get things done on my shift. So I was someone that was ready to do anything. So suturing, cannulation, antibiotics.
It's the cannula thing, is that the...
Yeah. Cannula. Cannula.
And I'm quite a ticklish person. So when you start, you get a preceptorship book. And I was like, a preceptorship, so like
I don't even know.
You're a midwife, you come on to, so you do different rounds and different wards, etc. And I was like, yeah, I need to get everything ticked off my list. So I did it quite quickly. I recently became a Band 7 midwife.
Okay.
So yeah, it took me about 5 years to become a senior midwife. I started diabetes about 3 years ago. So yeah.
Okay. So anybody who's watching who wants to get into diabetes specifically, the trick is to basically just work hard.
The good thing about midwifery is there are so many different areas to go into. So there's perinatal mental health. There's...
Wait, perinatal is before you have a child?
It's more to do with the mental health of a patient.
Yeah.
Okay. So dealing with women that have bipolar, depression, previous schizophrenia, previous psychosis, low moods in pregnancy and how to deal with that. Then there are midwives that deal with women that are homeless or refugees, teenage pregnancy midwives. Then you've also got the maternal medicine midwives who deal. There's so many. You can be a consultant midwife. You can be an IT midwife.
Digital midwife.
Digital midwife. So, for example, like we have a lot of systems within the NHS. And it's just about how they work. So the same way you would have an IT specialist in your place of work, maybe in the bank or wherever you have one in midwifery. So it's so wide, but yeah, if you wanted to be a diabetes midwife, it's just about finding the opportunity. So if you find a job opening, apply for it. And there's a lot of courses that you can do once you do get that role to become better and better. So it's but you do have to at least be a Band 6 midwife to be a specialist midwife. And that just comes with going around all the different wards, so postnatal, antenatal, labour ward, community. Yeah, they really like that.
Okay, awesome. Thank you. A lot of information there. And Anita, tell us, how did you get into midwifery? Did you always want to be a nurse?
No, I wanted to be a teacher. I wanted to teach children. So like Montessori, I don't know, kindergarten, whatever. Just teach, but not be a nurse. So I'm from Ireland, and basically in our end of secondary school, I had to decide what I wanted to do in uni. Nursing wasn't on my radar in the beginning. To become a teacher in Ireland, I needed to have Irish language, which I wasn't doing very well in. So I was thinking, what else do I want to do? I can't obviously go into teaching right now because I can't do it, basically, because of Irish language. So I spoke to my guidance counsellor, which I believe every secondary school has, to kind of rub minds with her to help me with my decision. And she said, take psychometrics test, I think it's called.
What's the psychometric test?
So when I did it like years, not that long ago, years ago, it's basically like a test online where they ask you a series of questions about your personality, how you'd manage certain situations.
Okay.
And you just basically choose your answers, and then from your answers, you get like a result, and they basically summarize what you're like or who you're like, and what jobs will fit your character or your personality. So from the list, when I took the test, I could see that I was a carer. I loved caring for people. I liked being in social environments. I liked talking to people. Me with computers, you couldn't put me in front of a computer. You couldn't put me with wires because I'd probably entangle myself with the wires. So after the test, then they gave a list of like occupations that provided these things that you could use your skills to do. So basically, it was like, if you've got people skills, these are the jobs that require you to have people skills. And nursing was bang on at the top. It was nursing and other jobs, but nursing just stood out to me. And I started warming up to the idea of like, oh, do you know what? I wouldn't mind being a nurse. Like, I wouldn't mind talking to people. I wouldn't mind looking after sick people every day. Like, that would be very rewarding. Yeah, it really stood out to me. So, on my application for university, which we call college in Ireland, on my application for college, I basically shoved nursing at the top of my list. Like, I wanted to be a nurse. That was it. I made up my mind. Yeah, I wanted to be a nurse, and now I'm a nurse. And I always say to people, especially like my students at work, I don't see what else I'd be doing if I wasn't a nurse. Like, I couldn't imagine if I wasn't a nurse, what could I do that I love so much? I can't think. Yeah, I love it. It's stressful, but I love it.
What you do. So we're gonna go for a quick break, and then we'll be back in a couple of minutes to see you guys. Welcome back again. Just another shout out to Flaky Bakes. Thank you guys for your amazing patties. I had one today. I had the vegetable one. It was amazing. So thank you guys again. So we're back. I want to have a little talk with Marie just about your crazy like stories, maybe on the wards or anything. I want to hear like some gruesome stuff. Have you got anything that's happened that's been crazy?
Not crazy, I wouldn't say crazy, but it's just been a bit, I don't know, like overwhelming. I think in my first year, like not knowing what I was doing, because I was 18 when I first started, so I literally started straight from school, and like being an 18-year-old on the wards, it's just overwhelming. Like really overwhelming, and I'm seeing things like stomas, because at the time I was on a surgical ward, so I was seeing things like stoma bags. Stoma bag is when a patient has an operation. I think it's called, there's different types actually. There's ileectomy.
Ileostomy is a colostomy.
Yeah. And then, basically they have a bag which is on their stomach because they can't actually like go to the toilet. So that's why the bag is there, so I had never seen anything like that before. So for me, it was really shocking. But as I said with nursing, like surgical ward, you can see people like the same age as me who've gone to the hospital just to have a tonsillectomy, which is just taking the tonsils out, or you could see like completely different things with different age ranges. I remember I saw someone, it was an elderly patient, and I have never seen dentures before. I didn't know what that was. She told me to open her box to help her. I was like, yeah, sure, I saw it and I just freaked out. I didn't know what it was, so I can't think of a crazy experience. Just getting used to it within itself is crazy, because the job is crazy.
A couple of other questions. You mentioned that you felt a bit overwhelmed. You just come from school to go straight into doing your nursing thing. How did you deal with that overwhelming feeling? Did you have a network of people that you spoke to, or?
One thing that's really important is just to make friends with people in your course. That's something that's really...
Before you go to...
before you go to placement, like, before you start placement, you actually do have university. So within that time frame, it's actually quite long. Like we start in September, and like in January, that's when you have your first ever placement. So within that time frame, you can actually make friends. You have lectures where you can meet people. Even like I know that now most stuff are like on Zoom, kind of. But you can still talk to people through there, or there's different societies, like nursing societies. I was also in that as well, where I was able to meet people. And that is also one element that inspired me to make my own page, where I could also like inspire other like student nurses or people even thinking of studying nursing, so they can actually understand what it's like, and to see somebody else going through and explain to them everything.
That's amazing.
Nurse Diaries UK on Instagram and YouTube.
Help me scroll up. There was a question for Kemi on the YouTube that I wanted to ask her, please. Yes. So it says, if you were to do your journey again, would you ever do nursing first? And what would you say to those who are going down that route?
Me and Jay were talking about that before I started. I think it's a two-part for me. Would I do nursing again? I think I would, yes, because like Maria, I was young. I started straight from college into doing this. So starting as a young 18-year-old, it's like, oh, hello, really brand new. And we're going straight into a working environment. Yeah, I worked before I went to university, but it's placement, it's people. So, and like a lot of medical terms came up, and I think the nursing background may have put me at an advantage because in midwifery you're looking after two lives. It's not just a baby, it's a mother who could have all sorts of medical conditions. And having to learn about her, not just a newborn baby that I believed initially, oh, just a baby, you know, but I had to learn a lot about that. So yes, I think I would have, but then if I thought about the process after nursing, you have to do like an 18-month transfer you have to do 18 months to do from direct entry of nursing to do midwifery. I can't imagine doing that 3-year course that I did of midwifery in 18 months. So for me, I knew I always wanted to be a midwife, so I couldn't imagine doing what I did in 3 years in 18 months. I don't know. So for me, that's the no part. I don't know, that pressure would have been a lot. But I think I may have, and I may not. But regardless, I've learned the terms now. But I would say if people, it may have given me a little bit more avenues. I think when you're a nurse and a midwife, you will open the doors for so many things for yourself. I'm a health visitor now, which opened other doors for me too, but I knew I never wanted to be like a band 7, like label ward coordinated midwife. So in nursing and having the midwife, you have avenues to do specialist this, you can do so many avenues if you have everything under your belt. So I think for people that know they may not just want to be on the wards, having that nursing and that midwifery gives you a big scope of practice and opens doors for so many things for yourself where you're not just stuck in one place, especially when you're starting very young. You have the time, you can kind of do it. So I think go for it.
Yeah. I have a question.
For me?
Yeah. For you. If there's anything different you could have done with your career or your studies, what would it be?
If anything.
Anything at all?
Maybe you answer then.
If I could change one thing, I think I would have believed in myself a lot more and did travelling. I would have travelled during uni. I remember I wanted to go to Tanzania just to see how midwifery was in other countries. And I think looking back now, you have so much scope to do that as a student because you're learning. Whereas now, they would expect me to start working there and I'm just like, I don't know what to do. But I think I would have taken at least a gap year to go somewhere across the world to just be a student and just observe how things are done in another country.
Can I say something? Because during the summer, I actually did do something like that. So I went on holiday to Ivory Coast because that's where like my family come from. And when I went, I just took a day, just a simple day out and spent the day in surgery. And that was really, really interesting for me. Just seeing the way things are over there. and I learned so much. So I feel like even if like you're on holiday somewhere, you can still take like a day out, just try and do research into somewhere, like a hospital near you, and then see if they will actually allow you to, you know, spend the day there and see how it's like.
That's a really good idea.
Well, we do get an alternative placement time, because that's when I want to do it. You know, in your block, I don't know if nurses get it. You get like a month or something where you can get an alternative placement. And a lot of people did go away to wherever they're from. I just didn't take the opportunity in time, you know, but it was a good time to do that.
We never had that.
Oh, we did.
We did. We have something, it's called elective placement.
That's it, elective. Yeah, that's it.
But now that so elective placement is a placement where you get to choose where you want to go. So with placement, you never get to choose, you just get allocated to anywhere. But with elective placement, it's the only opportunity within like your 3 years for nursing that you actually get to go somewhere. But unfortunately, I know that with COVID, like they limited it, so you can't travel. You have to just do something in the UK. But even that's like good, because you can just do anything that you want. It doesn't have to be like ward based. If you like aesthetic nursing, because that's the trend now. So if you want to do that, you can go into a clinic or anything and just see how that's like as well.
Right, so a bit of background now.
Put my legs down.
So again, like I mentioned before, we always have a lot of students that are watching. So we would like you guys to sell what you do to the students. Why should they study midwifery? Why should they study nursing over midwifery? So I'll give you guys a couple of minutes to deliberate amongst yourselves, just to think of your answers. And when I say a couple of minutes, I actually mean 10 seconds. So 5 seconds of it have gone. Exactly. That's why. See you guys? Okay, awesome. So, who should go first? Can I have a vote of who should go first, please? The midwives or the nurses? The first person that says it will be the one that we choose. We're just waiting for somebody on the comments to let us know what team should go first. So, the midwives or the nurses? First comment, nurses. Cool. So for any, because Anita was fighting, so for any students that are watching, you need to sell yourself, sell what you do basically. Why is being a nurse better than being a midwife?
Okay, so being a nurse, I think, is better only because we, like you guys, is just mother and child, right? Whereas with us, it's everyone, grandpa.
Sorry, I'm in the middle.
I'm taking side.
Grandpa, auntie, uncle, like it's everyone. It's also like everyone's included, which is really, really important. And also, it's something where you can specialize in so many different fields that it's literally not limited at all. There's also a crossover. We can do like gynecology. I was on a gynecology ward. I worked with midwives that were on my ward. So it's all about females.
Women's. Anything gynae, female related.
We can cross over too.
Yeah.
We can cross over. Can we rebut them?
It's you can do anything that you want to do with nursing. And Anita will carry on.
If you want a job where you get maximum satisfaction for helping people, not just women and baby. I mean, I'm talking about making a difference in a person's life, their family's life as well, ranging from zero, basically, because we have neonatal nurses as well, to neonatal nurses. So
baby.
They work with babies. So
as well,
wow. To geriatric nursing, which is the other end of the scale.
You cover everything, really.
We cover life, basically, from birth to death. If you want to be involved in someone's life in that way and get a sense of fulfillment from that, be a nurse. Because we don't just look after the nurse, the mom and the child, and then they go. after a couple of weeks. Your whole life, we're there. You need us your whole life. You don't just need us when you're coming out and you're like 5 weeks or 5 years old.
Thank you very much. So, you're responsive.
Okay.
Sometimes. I don't say this long.
You do want to.
Okay. I would say a jack of all trades, a master of none. It's always good to have one focus in life. And I would say the focus is the women and the child. But we do see the families and everybody. So being start of I think we're the most important part, I would say, which is start of life. And it's a beautiful thing. So if you want to be a midwife, always start. That's a great thing. You're at the start of life, an amazing feeling, euphoric feeling. You start off like at band 6 pay, which is, hey, everyone needs money.
No.
So, NHS, we don't get much, so these are the perks in the business. So I would say go for that. We'll start it.
I think I was going to say that, but it's fine. What Marie said...
Just from a senior's perspective.
I think what Marie was saying about gynae, we can also be sonographers.
Yeah.
We can also be... So we scan when the baby's the fetus is in the womb. We can scan, check for the gestation, check for any anomalies and stuff like that. So it's so broad. We can also go into gynae where we deal with miscarriages, ectopics. We deal with the very, very first scan you will have if you have any bleeding. So it's very, very wide. One other thing is that we get lots of goodies. We get a lot of gifts from patients, sweets, chocolates. On the
If your heart stops on the street, you'd want to nurse there more than a midwife.
No, we didn't. No, we've been learned. No, we learned.
We are actually trained.
We're trained.
We have yearly updates.
Okay. Thank you very much. So I'm going to let the audience vote, midwives or nurses, who have won today, and then I'm going to say my verdict like I did last time. So send your comments in. Everyone in the room, our audience as well. We have a studio audience. House of Medics. When you find it on YouTube and send your vote in.
Midwives.
Midwives or say no, but I'm gonna. I can't say that. I'll give you guys a couple of minutes.
Midwives.
There you go, nurses.
Midwives.
We've got.
Hey,
Midwives the most.
They need us the most.
Nurses.
I'm shocked.
Right.
I don't know why it's a shock.
No, we saw this
Short of midwife, we need you more.
Nurses again.
Oh no, where? Not late. I think we need 2 more minutes.
It's okay.
The woman's certainly worth your 100%. But yes, the 100% focus tomorrow. Thank you. No, wait.
Thanks,
You got 3.
We got 3.
Thanks, Shamara. Thanks, Nana. 3.
Thank you.
No,
Okay,
4.
Let's give them a minute. No, I'm not.
All right, 10 seconds.
10 seconds and we'll decide.
Take a seat. Thanks.
But yeah, no, today's been very, very enjoyable. Obviously.
Yes, I like this cover. Yes.
She's been political.
It's fine.
But no, I mean the winners are the nurses because some midwives have
less agros. Nurses because guys, you get it. Congratulations, guys. The nurses versus midwives. Not to say what you guys don't do is amazing. What I learned from today is that you guys kind of do the same thing, but you just do it with men as well. That's correct.
With children.
children,
young,
women,
old.
men, young,
Yeah.
old. You guys do the same thing.
Do you know what we are part of the same unit,
Yeah, we're in
so
the same
we're
team. I mean, they bring.
it's all love.
We look after.
It's teamwork.
It's
We need
teamwork,
we need each other. So we need at some point we need each other.
In the hospital,
If you guys had like I know we're meant to be winding down. If you guys had a pregnant woman there, you'd bring a nurse in, right?
No.
Oh.
Only like worst case scenarios, like I said to you, if a woman condition went really worse, like blood loss, ITU, we have had to transfer. We'll transfer straight to ITU, and the nurse come up for things like that. And
So you still need us.
yeah, that's what I said. Even no, we are.
Sometimes there's cases where like I'll get a call from maybe a gynae ward, and they're like, "Oh, can we get someone to come and listen to the baby's heart rate?"
Yeah.
So we both need each other.
We work together.
Exactly, we need each other.
Or we're covering our ladies from theatre. We're covering scrub nurses.
Yeah,
we need it. Yeah, in theatre they come and recover our ladies after they've had cesarean section.
You
so
can be a recovering.
you can be a recovery nurse.
I used to be a scrub midwife for like a couple of months. Yeah.
So yeah.
I've done it.
I'm just gonna end by
You lovely ladies, just letting us know your social medias where we can find you. If you have any sub pages like Marie does, please let us know as well. Kemi, I would like you to start if you don't mind. And also, some of the students here are into mentorship. So if you're ever willing to actually allow somebody to DM you and speak to you about what you do, that would be amazing as well. So if you can just look, Saz saying midwife 10 years later. It's too late now, Saz. Where were you?
Thanks so. Yeah, hi guys, I'm Kemi, professional auntie. I am CEO of Professional Auntie, like I said, and it's at Professional Auntie. I also do baby massage, first aid for all parents. I do bespoke postnatal visits for all families after birth as well, and I'm always open to DMs for students that need support. I've been a student myself, and I know how hard it is, and I'm willing to give any help and support. So anything related, please check out my website as well, www.professionalauntie, and my Instagram. Thank you.
your Instagram?
At Professional Auntie.
Lovely.
Thank you.
Sorry.
So my Instagram is Anita26. I do get a couple of like students and nurses reach out to me just for help on a placement day-to-day basis if they need help with like decision making. I don't do it like a social media thing, but I do get a lot of back channel. My social media is more, I focus more on living life, like work-life balance type thing. I'm not trying to come off as the educational nurse on Instagram. I'm just a living life nurse. But aside from that, I also have a business which is Knitter's Kitchen. So it's I do cook.
Oh.
I do cook. At Knitter's Kitchen, but with 2 N's at the end. So I make predominantly like Nigerian meals, but also intercontinental if needed. That's what I do.
Yes, as I said before, my Instagram page is nursediaries.uk, and I also have a YouTube channel which is Nurse Diaries UK. So that platform is literally there for student nurses. It's, to be honest, for anyone. Like student midwives can relate, everyone can relate who's in the healthcare profession or is thinking of going into the healthcare profession. So it's there to support everyone. I always do Q&As as much as I can, and I always ask you guys to explain like your experiences as well. So I'm more than happy to help anyone. If you guys want to message me, you can, and I'll be more than happy to help.
Thank you. So do you do YouTube lives and stuff?
No, I haven't done a YouTube live before, you know. YouTube's hard.
Lovely, thank you, Jade.
So my Instagram is allbirths_. I am also on TikTok, again, allbirths. What else do I do? I am an antenatal class teacher, so you can book me for bespoke classes or online classes. I'm also a BJM publisher, so if you want any British Journal of Midwifery, so yeah, if you want to cite me or if you want to get information about your dissertation or how to get into midwifery, I get a lot of that. And I also do aesthetics on the side as well, so like Botox, fillers.
Oh, you
so,
do?
Yeah.
Do you?
Yeah.
You missed out
Your scent stuff.
So I'm going to start selling candles, diffusers, and essential oils, mainly because throughout the pandemic, I was having quite a hard time dealing with going into work whilst everybody was at home, dealing with COVID patients. And the one thing that helped me relax was scented candles and essential oils. So I thought, why not create them? Especially for new mothers who often get overlooked. Like when you buy like the baby Pampers and gifts and whatnot, they don't get anything. So that's going to be coming out soon. So if you want to, you can follow me on my Instagram. It's AB Luxury. Yeah, that's it. Yeah. But yeah, follow me. That'd be nice.
Thank you.
Awesome. Thank you guys so much. That was really fun. It was really fun. So, again, we are House of Medics. Thank you guys so much for joining us. Yes, I have my phone out for the socials again. The website is houseofmedics.org. TikTok and Instagram is We Are House of Medics, and the LinkedIn and the Twitter is House of Medics. So, see you again in 2 weeks, and thank you so much for joining us. Thank you, guys.
Thank you.